As you know, a lot of doctors don't like this plan, including the American Medical Association, which you're a member of, which endorsed you to become Secretary of the Department of Health and Human Services. Tomorrow, a liberal healthcare group called Save My Care is going to launch a six-figure ad campaign against 24 Republican members of the House who voted to repeal Obamacare in this bill. The ad notes that the bill is opposed by the AMA, the AARP, the American Cancer Society. What's your message out there to someone at home who looks at that list, who watches this ad and wonders, if it's such a good idea, why are those three groups against it?
Yeah, I would urge them to talk to their doctor, talk to their provider. When I talk to the docs that I used to practice with right here in Atlanta, what they tell me is that the current system isn't working for them or for their patients. We've got 20 million folks out there across this land who have told the federal government, phooey, nonsense. I'm not going to participate in your program because it doesn't do what I need done. So they're paying a penalty. They're paying the IRS a fine or a penalty because the federal government is dictating to them what they don't want to do. Or they're saying, give me a waiver. Now that's a system, again, that may work for government. It may work for insurance companies, but it's not working for patients. So the system that we want is a system that works for patients and families and doctors. So talk to your doctor. Ask your doctor whether or not he or she is having challenges because of what the federal government puts in their way, the kinds of rules and regulations that make it more difficult for them to care for you. When I cared for patients, I knew that the federal government oftentimes was making it much more difficult for me to do for my patients what I knew to be best. And that's the system that we want to get away from. We want to get it in the direction of a system that works for patients.